There is a drug that is proven to help people with opioid addiction in a way that sets it apart from others available in the market, but not many people are using it here in El Paso.
Reporter Vania Castillo tells us why patients here in the borderland are having a hard time accessing the monthly injections.
Addiction affects even the most unlikely of people. Producer Isabella Dillman and I explore treatment options for opioid use disorder here in the borderland. And what we found out, providers say one of the most effective drugs used to treat substance use disorder is actually pretty hard to come by.
I had a house, I had a car, I had dogs, I had a husband, I had a yard, I was in the suburbs.
Addiction doesn't discriminate. Meet Colette. She worked for the Department of Health and Human Services, helping people with disabilities until she moved here to help her mom.
She became disabled. She's overweight and she has a busted knee and busted hips. And my dad died.
She says she'd never used hard drugs before. Then the unthinkable happened.
I developed schizophrenia. My mom decided that she couldn't help me because she was supposed to help herself with her disability. So I became homeless.
She says she started to use anything she could to self-medicate.
And I just tried to mind my business and live and survive and do what I was doing, but it was extremely hard. Extremely hard.
Colette is now in a medically assisted treatment program at the Recovery Alliance, or Casa Vida.
As the years go on and you pick up what you're doing in NA and AA, as you get better in it, as your recovery gets better, you start to realize that it's all the disease of addiction.
She takes a monthly shot of Vivitrol to curb her addiction. We spoke to Vivitrol providers about the drug. They say it's a long-lasting opiate antagonist, meaning when someone prescribed the shot uses an opioid, it won't get them high. The shot lasts about a month and then is re-injected, which providers say gives the brain a break from drugs and lets the person heal their neural pathways. Colette says not having to worry about taking medication every day is a relief.
Being on one med every day, to take every day and to walk around with you and to find a clinic and to get a prescription is so hard.
Manufacturers of Vivitrol say there are a few things that set the treatment apart from other medically assisted treatments like methadone and Suboxone. It blocks all opiate receptors. The long-lasting effects keep people off drugs for an extended amount of time, and the user can't get high while on Vivitrol at all. However, many El Pasoans stop at the price tag.
What we see is when it gets to our communities, places like El Paso, people don't have the means to purchase a medication like that.
Guillermo Valenzuela at Aliviane, one of the longest-standing treatment centers in El Paso, sees 250 clients on an ongoing basis and more than 150 people a year in their residential program. He says Vivitrol is not a popular choice at the center because of the underinsured population they cater to.
I'm talking about in the last couple of years, we may have seen 4, maybe 5 people go that route. And as far as I know, cost was a big contributor to the decision.
According to the manufacturers of Vivitrol, the shot wholesales for $1,641.11 a shot. Dr. Wayne Thornburg at Emergence Health Network says patients don't always pay that much. Some patients paying as low as $5 a month with copay programs. But Thornburg says sometimes the issue is that people don't know about these programs.
And I think a lot of individuals and providers may or may not want to go down those roads, and I think that's what limits the access to resources.
Thornburg says another reason people may stray away from Vivitrol is you have to detox completely before administering the shot, something that with more potent opiates like fentanyl is a harder process. He says this not only makes it hard to withdraw, but hard to participate in any medically assisted treatment at all.
Their tolerance level is so high that it makes it very difficult to transition them over to other substances.
Over at Recovery Alliance, patients say medically assisted treatments saves lives.
I call it the 7-bed room. Someone who comes in here, they usually stay in here 30 days.
And treatment centers say participating in the revolving door of treatment gives people jobs and a purpose. Mario Mendoza, the director of Recovery Alliance, is a perfect example of that philosophy.
I am a person in long-time recovery. I was staying at one of the local shelters here, and I just felt getting deeper and deeper into the addiction of my brother. Went looking for me, found me at the shelter, and I ended up at a detox place back in '09.
He's been sober for 15 years through treatment.
It's hard to convince someone to take that leap of faith.
If you want to live a healthy life, if you want to have a chance to be with your loved ones and enjoy the quality of life that you're destined to have, you're going to have to put some work on your side.
Recovery means making permanent changes to your lifestyle, something the recovery community says Vivitrol may help, but doesn't fix completely.
No different than a person that's been diagnosed with diabetes. You have to change your diet.
Hopefully from here on out I can get back on my feet, and my main thing is I need to stay on my medicine.
One of the copay programs available to access Vivitrol is called the Vivitrol Together program. For more information on how to get yourself or someone you love set up with the resource, head to our website, kfoxtv.com.